Why does traditional Chinese medicine TCM look at the tongue? In the world of TCM, the tongue is not only a tool for taste or an assistant to speech, it is more like a detailed map of the body, depicting the health of internal organs. According to the holographic theory, the tongue mirrors different parts of the body. The tip corresponds to the head and upper jiao, including the heart and lungs. The middle part corresponds to the middle jiao, revealing information about the liver, spleen, and stomach. With the liver on both sides and the spleen-stomach area in the center, the root of the tongue is linked to the lower jiao, reflecting the reproductive and urinary system. The central line of the tongue symbolizes the spine. As shown in the image, each area of the tongue is connected to specific internal organs. Thus, by observing the tongue, we can obtain the life information of each organ without complex instruments, only through a simple tongue diagnosis. This diagnostic method is not only non-invasive but also reflects subtle changes in the body immediately, allowing TCM practitioners to detect early signs of disease and formulate personalized treatment plans. Now, let us carefully interpret the language of tongue diagnosis. The color of the tongue body. Pale red. A light red tongue indicates harmonized qi and blood, a sign of health. Deep red or scarlet usually suggests internal heat, possibly due to various inflammations caused by heat evil. Pale white. A pale tongue may indicate insufficient qi and blood or an invasion of cold evil. Purple or dark, often seen with poor blood circulation, possibly involving blood stasis. The size of the tongue body. Swollen and thick, indicates damp heat in the spleen and stomach, or edema caused by weak spleen qi, often related to stagnant qi and blood in the body. Thin and small, usually related to insufficient qi and blood or malnutrition, often a manifestation of physical weakness. Teeth marks. Indents on the edges of the tongue are often due to the enlarged tongue being pressed by the teeth, a common sign of insufficient spleen and stomach function, usually related to poor digestion and absorption. Cracks in the tongue body, often a sign of chronic disease, an indication of qi dispersing outward, such as chronic gastritis in the stomach area. In the heart area, it indicates heart qi dispersing. Widespread cracks across the tongue, like cracked earth, not only consider insufficient fluid but are also a manifestation of blood stasis, which may be congenital if the tongue has had extensive cracks since childhood. Depressions or elevations. Depression. A depression in the tongue body indicates insufficient qi and blood or decline in organ function. For example, a depression in the heart area indicates weak heart qi, and in the lower jiao area, root of the tongue, it indicates weak kidney qi and reduced reproductive and urinary function. Elevation. If there is an elevation in a local area of the tongue body, it indicates stagnation of qi and blood or disease of the corresponding organ, such as nodules or tumors. Gently curl the tongue up to check the veins underneath. If the sublingual veins show worm-like twists and protrusions, with dark red lines winding over them, this is a sign of blood stasis in the body. These veins, like streams meandering through rock crevices, reflect poor blood flow, possibly related to organ dysfunction or stagnation of qi and blood. We continue to explore the mystery of tongue coating. The coating, a thin layer on the surface of the tongue, is like a coat the tongue wears. It meticulously records the health of the digestive system while also reflecting the body's cold, heat, dryness, and dampness. The color of the tongue coating. Generally, a pale white coating indicates coldness in the body, insufficient digestive fire. A yellow coating suggests internal heat, possibly due to food accumulation or inflammation. It is important to differentiate from discoloration caused by food. Coating thickness. The thickness of the tongue coating can indicate the health of the digestive system. A thin layer of coating is usually normal, whereas a thick coating may suggest indigestion or internal damp phlegm obstruction, particularly when the coating is abnormally thick. It might indicate long-term digestive issues or deep-seated pathogenic factors. Dry or greasy coating. The moisture level of the tongue coating is also key to assessing internal conditions. A dry coating generally indicates a lack of body fluids, whereas a greasy coating signals internal damp stagnation or damp phlegm. Peeled coating, or partial loss of the tongue coating that forms patterns like a map, is known in Chinese medicine as geographic tongue. It may indicate disharmony in stomach qi or a severe deficiency of stomach qi. We will give a few examples of tongue diagnosis. Case 1. Arrowhead tongue, bilateral tongue edges raised, indicates liver qi stagnation, liver qi rising. Red tongue tip, heat in the upper burner, cracks in the heart area indicating scattered heart qi. The lower burner is spindle-shaped, like a tightened cloth bag, suggesting insufficient vital energy. Case 2. A fat tongue body, dampness within, liver depression and spleen deficiency pattern, flat and red tongue tip, heat in the upper burner and the essence cannot rise, sleep disturbances, 2 obvious bulges in the lower burner. Pay attention to the possibility of uterine fibroids. Case 3. The upper burner is biased red. The lower burner is sunken with yellow greasy coating, a pattern of heat above and cold below. Kidney yang deficiency. A small protrusion in the middle of the tongue tip represents the cervical spine image. A midline crack in the tongue for the spinal region. There are neck, back, and lumbar pains. Case 4. Fat tongue body. Bilateral tongue edges full, liver depression and spleen deficiency pattern. Midline of tongue shifts to the left. The right side of the tongue is larger than the left. Lung qi stagnation. The lung and large intestine are exteriorly and interiorly related. There is constipation. Cracks in the heart and stomach area. Both heart and spleen are deficient. From the lips, it can also be determined that the patient has blood stasis. Every change, every hint of color, could be a reflection of the internal state of the body. Clinical practitioners of Chinese medicine can make more accurate assessments of a patient's health by carefully analyzing these subtle differences in the tongue coating and accordingly adjust treatment plans. The observation of the tongue coating is a meticulous and complex process that requires physicians to accumulate a wealth of clinical experience to master.